Please welcome our next guest, Dr. David Koenig. And he's an internal medicine specialist here with the Novant Health Inpatient Care Specialist team. How are you, Dr.
I'm well. How
Koenig?
about yourself, June?
Thank you so much for coming today. I see you in the hall all the time. We're always running into each other, it seems like. But this is a little different, little scenario here. So most of our day today was focused on advanced practice professionals, where we've had nurse practitioners and midwives on and so forth. And so I'm interested to talk to you about how the collaboration works between you and our advanced practice professionals. But first I want to talk a little bit about you. Tell me a little bit about your background.
So I did my training in internal medicine, which is a 3-year residency program. After completing that, I practiced in rural upper Midwest, Iowa, southern Minnesota, and did the traditional doctor thing where you rounded at the hospital, you worked in the clinic, you went to the nursing homes.
Oh my goodness, and you got home at 8 o'clock at night, right?
Some days, yes. Some days, yes. But I've been here now 13 years as a hospitalist, so yeah, I think it's maybe even 14. Yeah, it's going on 14. Wow.
Yeah, I know you've been practicing here for quite some time. It seems like forever. It seems like as long as I've been here. But tell me what you do as an internal medicine provider.
So as an internal medicine provider, I purely take care of adult patients. No, technically, we're not supposed to do anybody under age 18. Sometimes there's some give and take on that.
Is there some leeway in there?
Yeah, I think it's more of a malpractice issue than it is anything.
I see.
Don't take care of babies.
Right.
We do, though, oftentimes get involved with mothers of babies that may have some blood pressure or other issues related to their pregnancy, if it's beyond what the OB doctor is comfortable with.
I see. So. I see. So what do you enjoy most about your job?
I think as a hospitalist, the thing I enjoy most is helping patients kind of cope with that event that leads them to come into the hospital. Obviously, if you have something going on that you need to be hospitalized for, that can be kind of terrifying, somewhat nervous, because something obviously has gone wrong, and whether that is something minor that will easily correct, or whether it's something major that may have more of a life impact on you, helping to diagnose that, deal with it, and help the patient to come to grips and come up with a ready plan to make the most out of what needs to be done moving forward is really, I find it really rewarding.
Yeah, well, you're kind of like a detective too. You have to.
Yeah, there are a lot of times when people come in and you don't know exactly what's going on, and you have to kind of sort through that. Many times, the diagnosis is already kind of sorted out in the emergency room with some of the more common things. So yeah, there's some detective work and putting things together, kind of getting to be a bit of a Sherlock Holmes, I guess, in some respects, which is always I find interesting and challenging.
I bet, and I know you're very passionate about what you do. You really take great care of your patients.
Well, thank you.
We hear stories about the great jobs that you and your colleagues do. So.
Yeah, I think we have a great team. I think everybody works well together.
Yeah,
absolutely. And because we do change personnel every few days, taking care of people in the hospital, it's a pretty seamless flow so that everybody's on the same page, working towards the same outcome.
Well, as I said earlier, we're highlighting advanced practice professionals here for the next show or so. How would you best describe your relationship or the collaboration between you and the APPs here at Novant Health?
I would say it's truly a team model. The APPs and the physicians work together, be it rounding on patients, admitting patients from the emergency room into the hospital, reviewing the plan of care, reviewing medications that may or may not impact what testing should be done, how it may impact their medical problem at the time, what testing should be done. So I think it works well in an overall oversight of making the best plan possible to get the patient where they want to be.
I think you would agree that it's not, the whole show is not run by the physician. There's a whole team, a whole plethora of people involved to make the patient feel better and get to where they need to be to live a productive life. So, and the APPs would be part of that, along with radiologists and what have you. Would you agree to that?
Yeah, I think that's really been a focus, and I think one of the things Novant and our group has also done in the past few months is kind of worked on a team rounding format where we sit down for at least 15 minutes with nursing, physical
That happens
therapy.
every morning, right?
Correct.
You have,
yeah, so we've got nursing, physical therapy, case management,
Yeah.
all in one room, so we know that we're all talking the same language, making the same plan, and that patients then will know that if we're going this direction, that's the direction we're going, and that
Right.
not somebody saying, hey, we're going left and you're going right. And
Right.
So
Yeah. I have heard some folks say, oh, they would rather not see an APP, they would prefer to see a physician. What would your response be to somebody who said that to you in the hospital?
I would say it's probably somewhat based on the complexity of your medical problems. If you have, 5, 6, 7 different medical problems and you're taking 10, 12, 14 different medications,
More.
maybe that's correct. But I also know that there are plenty of APPs out there that are very competent, very professional, very well able to manage most medical conditions. I know at least in the Novant system, you've got again that extra layer where the APP is in a clinic with a physician and supervised by a physician. There's that collegiality where you can
Right.
ask questions of each other to make sure you feel like you have a little extra level of comfort with making the right choices for
Absolutely.
managing a medical condition.
Yeah, I like to think of it as checks and balances.
Yeah, I think
There's
that's-
always another set of eyes, a set of ears, and I never fear of seeing an APP in any of our offices because I know there's a doctor right around the corner, and you all are discussing what's best for me as a whole. So that's why I feel really comfortable with them and the way Novant Health pairs them with physicians.
Yeah, I think that's a very fair statement. And again, I think medicine has evolved such that so many of the parameters for goals of care are tracked not only by your physician and by the patient, but it's also tracked by your insurance company. So, whether somebody's probably going to hear about it if you're reporting to your insurance company that your blood pressure continues to be elevated, that they're going to say, well, maybe you need to get something done about that.
Right.
So.
Well, thank you so much for taking time out of your day today to be with us. It's much appreciated. And I hope I'll see you around in the halls.
Oh, I'm sure you will, June.
All right.
June,
Take
June,
care.
Sorry. All right. Thank you very much.